To say that healthcare organizations are juggling a lot right now is certainly an understatement. We're seeing surges of COVID cases all across the country. A lot of hospitals are grappling with scarce resources and how to allocate those. And in the midst of that, we're undertaking the largest vaccination campaign in U.S. history. There has never been a more important time for healthcare organizations to nurture and reinforce the trust that our communities place in us. The public has a lot of questions. And one great way to engage with the public and answer those questions is through local news media. Here's a few things to keep in mind as you're engaging with local media right now. First, be prepared to get technical. The public has an intense interest in topics that would have only been covered by trade journals just a few years ago. Things like double-blind studies and vaccine storage and transport requirements. So don't be afraid to talk about your processes and even show some of the equipment that you're using to keep those vaccine doses safe for public distribution. Tap a clinical leader as your spokesperson for these interviews, ideally a physician, an infection preventionist, someone who naturally carries the trust and respect that you're looking for in your audience. And as you're preparing for these interviews, make sure that your clinical leader has received training on how to take that highly technical information and make it accessible for a lay audience. In general, news media is going to write for about a 6th grade reading level, and that's just to make sure that anyone who accesses that story is going to be able to understand it and internalize the message that it carries. So, if you happen to have a 6th grader handy or someone around that age, it's a great idea to practice your messaging with them. If you can keep your message short enough to hold their attention and make the language simple enough for them to be able to understand it and repeat it back to you, you'll know you're right on target.